Welcome to Module D of the Training Toolkit by the European Laboratory Initiative, in which we will discuss ways to minimise contamination. High-quality laboratory services are an essential component of TB care and control. Indeed, incorrect results not only adversely affect individual patients, but more fundamentally can also lead to a loss of credibility in diagnostic services by clinicians, resulting in more empirical treatment that in turn will exacerbate the spread of drug-resistant TB. In this context, contamination, i.e. the unwanted introduction of bacteria or DNA, represents a constant challenge. Contamination can never be fully eliminated, which is why negative controls have to be included in every run, as outlined in Module B. Nevertheless, the frequency of contamination can be reduced to a minimum by implementing a series of measures that have to be reviewed continuously. Many of these strategies, which will be outlined in this module, are organisational and technical in nature. But these can only be effective if a no-blame culture is fostered. Every single person in a laboratory is responsible for the overall quality of testing and should be encouraged to speak openly about problems and mistakes that they have made or have observed. In other words, staff should not be afraid of making and reporting mistakes. Instead, it is paramount to learn from these experiences and to put systems in place to minimise errors in the future. We would like to stress that these are not just challenges in low- and middle-income countries, but also apply to well-resourced laboratories. For example, in 2013, at a national TB reference laboratory in a high-income country, almost 40% of the negative controls for the line probe assay, or LPA, for first-line anti-TB drugs showed evidence of DNA contamination. Importantly, this study highlights that the subsequent improvements were not due to the introduction of a single measure. Rather, continuous improvements to quality management over several years by all members of the laboratory were needed to effect change. Now let's focus in more detail on contamination with either bacilli or DNA, which can occur at any step of testing. The fact that PCR can detect very low bacterial burdens because of the exponential amplification of DNA is the strength of this approach, but also makes it exceptionally prone to contamination. A typical PCR reaction generates as many as 10 billion copies of the target sequence, and aerosol from pipettes can contain up to 10 million amplicons. Once aerosolized, amplicons can contaminate any item in a laboratory, including the ventilation system, requiring time-consuming and expensive measures to remove them. Here are some examples of the potential sources of contamination. But many other sources are possible, which underlines that no single measure can completely prevent contamination. Aside from the no-blame culture discussed earlier, three main approaches have been shown to minimise contamination, which comprise the design of the laboratory, good laboratory practice, and chemical controls. Physically separating the pre- and post-amplification areas is key. Specifically, three areas are recommended. The first room should be a clean area, ideally with positive air pressure, to ensure the safe storage of reagents. By contrast, the remaining two rooms are both dirty because they are used to handle either specimens or DNA and should consequently have negative air pressure. This diagram shows the three separate rooms. It is key that you maintain a unidirectional workflow from rooms 1 to 3 and that any backflow is minimised. The first area is used for storing all reagents necessary for the work in areas 2 and 3. Crucially, no specimens or DNA should ever be taken into this room. Moreover, you should aliquot the reagents that you actually require in areas 2 and 3 rather than taking the whole tube with the reagent into Area 2 or 3, so as to avoid having to return a partially used tube of reagents to Area 1. Aliquoted reagents needed in Areas 2 and 3 may be stored in the short term in these rooms, but this should be minimised. For example, when using the first line or second line LPA, prepare a master mix containing the amplification mixes A and B in Area 1. Add DNA in Area 2 only, and finally, carry out the PCR and hybridization in Area 3. In Area 3, it is also advisable to physically separate the PCR from the hybridization step, if possible. This can, for example, be achieved by placing the thermocycler in a box with its own exhaust. The unidirectional workflow applies to all personnel and items. This includes cleaning staff who need to be trained appropriately. If you have to take items, such as racks, in the reverse direction, these must be bleached to remove bacteria and DNA. Please ensure that each area has dedicated standard operating procedures to ensure that these do not have to be carried from one area to the other. Electronic laboratory information systems further minimise the movement of paper. To ensure a unidirectional workflow, each area must have its own equipment, supplies, and ventilation system. Any movable items, such as pipettes and lab coats, must be colour-coded so that it is obvious if they are inadvertently moved from one area to another. For example, if you forget to take off your coloured or colour-coded lab coat and go into another area, your colleagues will notice this immediately. In addition, good laboratory practice is essential to minimise contamination. Even when using positive displacement pipettes with filtered tips, you must pipette carefully to avoid the formation of aerosols. Use sterile disposable plasticware and adopt the remaining measures listed here. As mentioned already earlier in this module, you must include a negative control in every run. Please store, aliquot and label your reagents appropriately. More generally, please keep your laboratory tidy and dispose of waste regularly. Maintain and calibrate your instruments and provide regular staff training. Finally, do not forget to document all relevant laboratory activities. It is crucial that you clean your workspace before and after your work, i.e. do not assume that your work area is clean when you start, as the last person to use it may have forgotten to clean it. If you have to process many samples, change your gloves regularly and wipe down your pipette and equipment throughout. Put a rotor in place to ensure that the entire laboratory is cleaned regularly. In this context, do not forget doorknobs and the handles of equipment. Each laboratory should have a quality control plan in which you monitor the frequency and outcome of all controls carried out. Importantly, you must investigate every single unusual result. For example, if during drug susceptibility testing a negative control turns out to be positive, you must identify the likely source and eliminate it. This always requires thorough cleaning, and you may have to discard reagents if they have become contaminated. In addition, please participate in relevant quality assessment schemes. In summary, a diagnostic laboratory is a complex environment, and no single measure on its own can prevent contamination. Instead, numerous technical measures, coupled with a no-blame culture of continuous improvement, are needed. If you would like to learn more about this topic, we recommend this guide by the Global Laboratory Initiative, which has a good chapter on contamination and many other aspects relevant to running a laboratory effectively. Last but not least, thank you very much for your attention.